We have an agenda today to talk about the economic forecast, revenue forecast, Medicaid forecast, COVID-19 funding and response, and then a few items on the consent review list for building projects. So we'll go through that. So the first order of business is Mr. Jackson on the economic forecast. Thank you for being here. Appreciate you coming to Indiana today and being in person. And the floor is yours.
Thank you, Mr. Chairman. I do appreciate you folks bearing with me in my virtual appearance back in December, but it was good. I've been staying over back where I grew up a couple hours from here last couple of days and resisting the urge to get out and drive the tractor and stuff. But no, just want to talk today about our outlook, and particularly, you know, I know that this time a lot of the emphasis needs to be on some of the changes from the December forecast, and it's been quite a ride the last year, pretty much right now, little more, trying to get reoriented, but you know, to kind of focus a little more on recent things. We've had some upward revisions, even just over the last month or so, to the forecast, you know, and some of that is due really in the shorter term. A lot of that is just based on, you know, some of the spending we've seen, you know, discovering a lot of kind of real-time data, you know, things like credit card spending, really giving us a little more, you know, frequent updates on some things than some of the official estimates that come a couple of months later. You know, so certainly seeing that spending, so that, you know, real GDP growth. But again, you know, these are pretty impressive looking GDP growth numbers relative to a base period. But we still have to remember that these for now these growth rates, these increases are off of, you know, so, you know, we're still coming out of a pretty good hole in many cases. Certainly the you know, vaccination progress, and, you know, more broadly, just the ability to reopen parts of the economy that have been affected, you know, is another factor. That's something that we actually were figuring on basically in December, but I think we've seen more, you know, if you call it just confirmation, you know, has made us feel even better about being able to move forward with that. Certainly the Federal Reserve, a lot of my colleagues spend more time worrying about the Federal Reserve than I do, but you know, the certainly signals from the Federal Reserve are that you know, they're absolutely in no hurry to you know, raise rates or anything like that. Really you know, less concerned about inflation than they are about, you know, trying to get back to more full employment numbers. In terms of policy assumptions, this has, of course, been a huge one over the last year. Again, we've had to learn some new terms and some, you know, kind of really dig into a lot of the accounting. I know I've talked with Mr. Habig and Hari and various ones about how we're accounting for a lot of these dollars and where that is showing up in the forecast. You know, and certainly one of the assumptions, not necessarily a policy assumption, is that we assume no real significant relapse in, you know, COVID cases, reopening maybe a bit here and there, but relatively minor. And again, that's an assumption that we make moving forward. You know, but certainly a lot of it is that, you know, the recently enacted, you know, recovery program back in March, and I'll point out that our December forecast didn't include any of this, you know, in any of the money that was passed in March, and really the December forecast didn't fully incorporate. We were really fairly conservative in our policy assumptions back in December, really, you know, leading up into January about what would come about in terms of some of those, and that was really just the $600 stimulus checks, you know, some of the extended unemployment benefits, that kind of thing, really was not fully in that December forecast. So, you know, you folks have seen kind of the list of the items there. I won't rehash those. One thing I will say is that our current forecast does not include really any specific aspects of, you know, what's being called the American Jobs Plan, you know, whether it's the infrastructure bill, investment bill, what you want to call it. This really doesn't specifically incorporate any of that. So, you know, I guess we kind of bear that in mind as an upside, you know, risk or potential of the forecast from where we are right now. And there certainly are downsides too. We'll talk about that. But I just want to, you know, it's been very important to make clear what this forecast includes and what it does not in terms of federal action. And really another one that is, you know, a little bit of an indirect effect is that really stronger than expected tax revenue collections in many cases, in addition to money provided in the American Recovery Plan, you know, probably will help to support state and local government employment more than perhaps, you know, we were expecting before, or at least, you know, we were recognizing the risk of more contraction. That's certainly one thing that we saw coming out of the recession of, you know, 2008, 2009, was that, you know, really government employment ended up being, you know, kind of a, you know, holding back overall employment numbers some, and it's something we don't always think about, but certainly there. In terms of the Indiana economy, again, you know, most of the, well, all of the upward revision to the Indiana economy reflects what we expect at the U.S. level. You know, some of the upside there. You know, we don't just, you know, do things in lockstep, saying, okay, well, this goes up 5% at the U.S. level, so it goes up 5% in Indiana. That's not how it works, but, you know, certainly a lot of these, you know, whether it's the federal stimulus or just other things going on with the economy, you know, to the extent that they affect sectors in Indiana, that pulls up the Indiana forecast. But certainly, you know, Indiana really early on didn't see quite the effects that some other states did, although some of the revised employment projections that we got in March showed that, you know, certain aspects got hit a little more than we initially thought, which actually made sense. You know, one of the big things that has been different about this whole, you know, downturn and recovery has been that many aspects of manufacturing have come back much more quickly than we normally see in recessions. Oh, I'm sorry. Thank you. Just please yell at me. I'm sorry. Just I apologize for that. But, you know, one thing that we have been keeping an eye out for with manufacturing, and we've seen this with computer chips and things like that, is just it's really made us appreciate supply chains, and you know whether we're still in just a just-in-time mode or whatever you call it. You know, things really have to keep moving on time, and, you know, one thing being late makes a lot of other things late, just holds things up. And that's not always something that we can afford. So again, you know, the job recovery, again, like we expected, you know, we saw, you know, from that initial big downturn, saw, you know, some pretty impressive looking growth early on, slowed down a bit, especially as we got into fall and winter, and now, you know, now we're still seeing some steady growth. You know, really one of the big you know, question marks, you know, probably risks moving forward is just really, you know, a lot of these service sector jobs, particularly a lot of the lower wage jobs, you know, a question of, you know, when they'll come back and really if they'll come back in some cases, you know, whether they'll be replaced by automation, you know, whether the demand, even if the demand fully comes back, even if the activity fully comes back, you know, checking into the hotel last night, doing, you know, e-check-in. You know, you go to a restaurant and there's a little kiosk. You know, fortunately, they didn't make me try to figure out how to use that, but I know that's been increasingly adopted, and ultimately that can translate into lower numbers of jobs. And, you know, that's a thing where those jobs, you know, ultimately need to be replaced somewhere else. So getting a little more into some of the specific changes, basically all of the major indicators up, some directly correlated with the federal stimulus, whether it's the stimulus checks, real GDP, gross state product, personal income, both in terms of wage income, whether it be, higher employment levels in some cases than we were thinking before, but also, just really wages being boosted. And that's certainly one, just the issue. I don't want to spend too much time on this, but that's definitely one that we do need to understand in terms of as we look at employment numbers and compare that, sometimes those seem a little bit out of line with what we see in wage income, personal income, even in terms of tax collections, that kind of thing, that, really, and I'll illustrate that here in a minute, is just how much, it's kind of changed the equation, but, the overall wage income is a function of more than just employment levels or really even, say hourly pay. It's also, just how much you're working is a component that we don't think about as much as the others, but we've really had to think about it now as we try to make sure this all adds up. So kind of the bottom line of this is, pretty much every major indicator higher than in December. I guess one thing I'll say in terms of the personal income and particularly consumer spending is that we do expect kind of a lagged impact. We're already seeing this, and I know Hari and I have had conversations about this, is that even with the higher spending levels, they're really not commensurate with the levels of personal income that we're seeing, particularly in terms of a lot of the transfer payments and a lot of that. So basically that has pushed implied savings rates really high, and that's not something that we're used to seeing. So, there's still a lot of money out there really not being spent yet. So we figure that over the next 2 or 3 years, as things open up, that basically, people have money they haven't really had to spend, kind of hanging on to it, waiting till they can, make trips, saving up to buy certain things. So that's really very much of a lagged effect of these stimulus payments that has yet to fully hit the economy that we're expecting over the next few years. So I kind of always show these charts. I think the timing right now is really interesting. Probably reinforces something that we already really know, just in terms of, just happened to be looking, February 2021 is the last monthly employment numbers that we have, and really February 2020 were the last numbers that we had available before, some of the effects started hitting in March. The big effect was in April. We're used to seeing these bars going the other way and not so many negatives. But certainly, as we see down at the bottom, as we know, leisure and hospitality accounting for just a very large component of, the total job losses that we've seen over the last year. State and local government, to be clear, many of those jobs are probably in public schools. The public schools, both, elementary through high school and state universities are counted under state and local government, so there have been some staff level jobs, those kind of support jobs that, haven't been working over the past year with, maybe just partial opening of schools, that kind of thing. Health and social services is one that has stuck out to me that I guess I hadn't really thought about so much initially with, the downturn, because certainly, a lot of folks in the healthcare sector have been extremely busy over the last year. But then, whether it's the more routine components of healthcare, but particularly a lot of the social services and a lot of the, interpersonal, whether it's home visits, just a lot of those support kind of jobs just haven't been done nearly as much over the last year, just out of, concern over face-to-face interaction. So that's one sector where we would still see, some good good prospects for, some increase over the next year or two as things normalize. Manufacturing, jobs down, but certainly a lot of the activity, a lot of the overall wage rates, that kind of thing, still doing relatively well. Transportation and warehousing, many of us have heard about, all of the changes in there. And, really some places, transportation in terms of, hauling people, moving people have not been doing nearly as well, whether it's public transportation, airlines, that kind of thing. But, certainly moving goods has been moving right along. Illustrate a point that I started to make earlier. And this is one that we'll be keeping an eye on moving forward, certainly, is that since so many of the job losses were in low wage sectors, we really had to go back and take a look at, where this wage income is going, and and really again looking at, and this is average annual wage, which is how much you make in a year, which is a combination of your pay rate to the extent that applies, but also the number of hours you're working, and we've seen a jump in that. And again, a lot of that is just really kind of taking some of the lower end out of that distribution, and that's something that we see gradually coming back over the next 2 or 3 years, but not really fully coming back. And to some extent, one thing we're seeing is some increased productivity coming out of a lot of this, maybe being forced to do things we already were able to do, in terms of utilizing technology. So just wanted to illustrate that just kind of quickly. And I will say, as always, I stuck some slides on the end that really are more just for reference on some of our U.S. stuff. I don't even intend to talk about those. Just the K-shaped recovery, this has been a big one to me, particularly in terms of looking at some of the low-wage jobs. I apologize if this is a little tough to read. I pulled this slide. But as we can see, in terms of the number of jobs, compared with really when this all started over a year ago, the higher wage jobs are up in Indiana relative to a year ago. More middle wage jobs down 4%, but then those low wage jobs, really the ones that have been persistently much lower over the last year, and not have, and these numbers are through mid-February, so those would have improved. But really just want to show again, what we've been very much talking about in terms of that K-shaped recovery, and kind of the lower leg of that, so to speak. Really getting that pulled up is key to, getting more of what we would call a full recovery of the economy. Very quickly hit this slide. Stimulus payments that's been a big factor supporting consumer card spending. Just shows that in this case, then the distribution of spending across the income groups has been a much lower difference. That basically the stimulus payments going to the lower income folks, at least our theory is that has been much more directly stimulative of spending, spending that needs to happen, and hasn't increased it that much more on the upper income end. I won't read all these numbers to you. Again, some of these are I've had to really take a step back and make sure that these numbers make sense to me early on, particularly some of the differences in personal income versus wage income, comparing wage income with employment levels. And again, that's all just some big changes that we've seen in terms of average wages, relative to employment levels, personal income being boosted by, particularly when we start seasonally adjusting and annualizing these numbers, just really large boosts in the transfer payments that translate directly to personal income. Gross state product down in 2020, but coming back, very strongly. And again, these are annual averages for 2021. Growth really starts to normalize in 2022 and 23, but certainly from higher levels in 2021 than than what we had in mind back in December, certainly. So really won't spend, this is one I've shown before, but, kind of just, whether it's a feature or risk of the forecast, one thing that we've seen is just a big shift in spending away from services in many cases because people couldn't take advantage of the services, and a shift toward more goods, that's boosted manufacturing and that kind of thing. Also boosted things like sales tax collections. We do see that, getting more back to normal over the next 2 or 3 years. So those are kind of the things that some of the things that have changed over the last year will be gradually changing back. Others won't be, and that's certainly one of the big things to be watching as we move forward. Again, auto sales, big rebound there. That's pretty much what we were expecting back in December. Certainly low interest rates, stimulus payments, just, a lot of folks maintaining their incomes quite well has been very supportive of a big industry in the state of Indiana. Bottom line, again, this will just be a rehash of what I've said. I'll kind of raise a couple of points at the toward the bottom. A little bit of risk factors I look at. As one is just kind of, again, just kind of financial fallout. There's really been a lot of missed payments and that kind of thing. Delayed payments over the last year or so, and those can lead to other missed payments. So I think there's some things to kind of sort out there, really in terms of the national economy. I guess one thing I haven't talked about too much is home building. I think many of you have looked around and seen both, home sales, home prices through the roof, really to the extent practical, really stimulated some home building. And that was really a feature of the recovery over the last 10 years or so that never really came back the way we thought it would. And so now it's interesting that at least in the short run, we really are seeing, for whatever reason, this, hey, you got to have more housing. Some of that is a shift in demand, whether you want to go more to single-family housing, maybe not, where you can spread out a little more, different types of housing, that kind of thing. And certainly a lot of it is trying to take advantage of low interest rates, that kind of thing. But it's certainly also been a big factor that has been slow to materialize over the last few years, but it's certainly been a big boost. We expect that to moderate a bit over the next 2 or 3 years, but not really post a significant decline. So with that, I've probably said as much as I have useful to say, but I'm certainly happy to answer questions at this point.
Thank you very much. Where does Indiana fall within the Midwest and nationally? Are we pretty average? Are we above average? Are we below average?
I think particularly in terms of kind of neighboring areas, Indiana really has been above average for a while. I don't really want to overstate that. I think a bit above average nationally. Part of that has even been just things like population growth. Really, Indiana hasn't had the areas that have been losing population. Maybe it's that don't have some of the older line cities that had been losing some population, like some neighboring states over the last few years. But it's been doing relatively well.
The stimulus money, I think, will spur inflation. How will inflation impact your forecast?
Well, yeah, basically, we consider it a risk, ultimately a downside risk. I think basically our feeling for now is that it will stay at manageable levels. I think, part of the key with inflation, probably relates back to this issue of certainly the stimulus payments and, kind of the income side is one part of it. I think, really over the last year, we've just seen so many imbalances in the economy in terms of the sectors that have been doing well, the sectors that have been, business as usual, if not better than usual. And so those sectors, in many cases, have had trouble keeping up. Building things like, lumber prices, a lot of raw material prices going up, in many cases just certain items, whereas, services, have been much more lagging. So some of the inflation pressures that we're seeing, and have been seeing, we see easing as the economy kind of adjusts back to normal, whether that be, the shortfalls in certain areas, get addressed better, or demand starts to shift back more to, more normal into the services, that kind of thing.
Okay, thank you. Questions, committee members? Representative Porter.
Thank you, Mr. Chairman. Thank you. I just have a quick question, just a point of clarification for myself. On slide 8, where you talked about the percentage of change in employment and the high wage, middle wage job, is that individual or is that household income? If you have a high wage plus 1.7%, is that individual income or is that household income?
That's individual workers. I believe it is. Honestly, I will add that caveat. I believe that's individual jobs in terms of the wage rates per job.
And so is there a way to look, because individual jobs, so if you have two individuals that are working within that household and they're plus 1.7, that makes it even higher, right, in regards to?
Yeah, you're right. And I guess I'll add to that, even some workers, can be working 2 or 3 different jobs, and that counts as 3 jobs, even though it's one person. So,
right.
As far as I know, these numbers do not fully account for that effect. Yes.
Okay. Thank you. Thank you very much. Thank you for your presentation.
Thank you. Any further questions? Thank you very much.
Thank you.
Next, Hari and Mr. Tooley. Mr. Tooley, you get to stand.
Morning, Mr. Chairman, members of the committee. Stock said, my name is Ben Tooley, and I'm the Director of Fiscal Policy for the House Republican Caucus. To my very far right, I can't even see him, he's so far away, is Hari Razafindramana. Hari is the Assistant Director of Revenue at the State Budget Agency. So now that you have all seen the economic forecast, Hari and I are here to present you with an updated forecast for fiscal years 2021, fiscal year 2022, and fiscal year 2023. But first, as I've done in the past, I just want to take a few minutes and, well, not even a few minutes, a few seconds, and say a few words about the Revenue Forecast Technical Committee, its members and staff. I think it's a good reminder for everyone. The charge of the technical committee is to select the equations used in the revenue forecast. Those equations are matched up with the economic variables projected by Mr. Jackson and his team at IHS Markit, and we use those to predict future general fund tax revenues. Technical committee is a 6-member bipartisan committee, and like the budget committee itself, is a collaborative effort between the legislative and executive branches. Most importantly, the revenue forecast is a consensus forecast, which means that all members of the committee agree that what we present to you today is our best effort at projecting the amount of general fund tax revenue that the state will collect this fiscal year and in the upcoming biennium. Aside from Hari and myself, the other members of the committee are Eric Gonzalez, fiscal analyst for the House Democrats, Susan Preble, fiscal analyst for the Senate Democrats, Krista Ritchie, senior fiscal analyst for the Senate Republicans, and Dr. Dagny Falk, who is the committee's independent economist from the Miller College of Business at Ball State University. Also want to give a special thank you to the staff of the State Budget Agency and the Legislative Services Agency. They play an absolutely vital role in the process. We are clearly in unprecedented economic times, and the past year has been nothing short of a roller coaster ride for both state revenues and, as mentioned in Tom's presentation, economic outlooks as well. This team has put in a lot of extra hours over the summer, throughout the fall, throughout the winter, and now throughout the spring, evaluating revenue trends and testing new models, and I do think they should be, recognized for their hard work. And then finally, as I always like to do, I like to thank the Budget Committee members themselves just for their continued support of this collaborative process by which Indiana estimates tax revenue. So moving on, slide 3 in your packet shows how revenues have performed through the first 5 months of fiscal year 2021 as compared to the December 2020 forecast and the same period revenue in fiscal year 20, which would be the same 9-month period last fiscal year. As you can see from the slide, the big 3 major tax sources, sales, individual income, and corporate, which together, keep in mind, they account for 92% of our general fund forecasted revenue, are all trending well above the year-to-date targets that were set in December and are considerably above the same period in fiscal year 20. Sales tax revenues are currently up 6.6% as compared to the same 9-month period in fiscal year 20, which of course is a period of time that included the first month of the pandemic, March of 2020. Individual and corporate income taxes are also above the December 2020 targets and the same period revenue in 2020. But as I'll touch on a little bit later in the presentation, a lot of that is due to the delay of the income tax deadline last calendar year when we delayed it from April until July. And then finally, point out the total revenues are currently outpacing the December 2020 forecast targets by about 3.4%. And as compared to the same period of revenue in fiscal year 20, we're outpacing those collections by about 12.9%. Again, keep in mind those growth rates are significantly impacted by the shift of income tax revenue from one fiscal year to the next. So just always keep that in mind. Slide 4, you just got the revenue, or the economic forecast, so I'm not going to spend any time on this, but this slide outlines some of the factors that are really the driving force behind the changes in the updated revenue forecast. As Tom mentioned in his presentation, the December revenue forecast occurred before the enactment of, well, certainly the Consolidated Appropriations Act, and also, the big American Rescue Plan of $1.9 trillion. Those were things that were not known at the time the December 2020 revenue forecast was presented. Both of these pandemic relief packages, especially the ARP, have had a substantial impact on the economic outlook, and of course that means that they are also strongly influencing the updated April forecast. Slide 5 lists some of the major tax policy factors that impact the revenue forecast. One thing to note here, these are the exact same factors that I had on the slide for the forecast in December. Nothing has changed. We do not change our forecast based on pending legislation. We only look at the law as it stands as of today. Moving to the models, slide 6 lays out the variables that comprise the models used to project sales tax, individual income tax, and corporate income tax. The models used to estimate the big 3 taxes are, for the most part, they're essentially the same models that were used for the December 2020 revenue forecast. One change I will point out is in the sales tax model, we had been using prior fiscal year home sales as one of our variables. The team over at SBA and LSA took a look at that. We were having some statistical issues with the model. If we substituted current year home sales in place, that corrected the issues that made the model a lot stronger. And also it didn't have a substantial impact in the out years. It did affect fiscal year 21 a little bit, but it didn't have a massive change to the out years of the forecast. Slide 7 shows the additional out-of-model adjustments that the committee has made to various components of the forecast. Generally, when we make out-of-model adjustments, that is to recognize recent tax policy changes that are not captured within historical data sets or to account for just unique circumstances. And then before I get into what everybody's actually here to see, I like to show this slide. The committee likes it as well. Our sales tax is 50% of our overall revenue forecast. So this slide illustrates how some various components of that sales tax forecast have changed over the years. The biggest is we are shifting gasoline use tax revenues out of the general fund and back towards road funding. So you see the darker blue bar getting a little bit smaller over time. And then the other two colors of the chart, the goldish color and light blue or green on the top, what that's reflecting is the Wayfair decision at the federal level, so we can tax remote sales. And then also we passed some legislation a few years ago to pick up on marketplace facilitators. That is an ever-growing portion of our forecast. It's still not the bulk of our sales tax forecast, but between those two components, I believe our adjustment was somewhere in the neighborhood of $650 million in fiscal year 2023. So it's very significant, and I think it's played a significant role during the pandemic when people were at home, and perhaps we're all guilty of this, looking at Amazon on your phone or whatever else. Okay, well, I guess we'll get to the results. Slide 10 shows how shows the new revenue projections for the sales tax, individual income tax, and the corporate income tax. Keep in mind this is 92% of our forecast right here. Just want to point out a couple of things, a few key takeaways. Sales tax collections for fiscal year 21, we have increased that forecast by $263 million as compared to the December 2020 forecast. We now think the year-over-year growth as compared to fiscal year 20, which of course was a fiscal year that included several months of the pandemic, which depressed sales tax revenues. We think that growth rate's now going to be about 8.6%. Now, I will say, if you go back to one of the earlier slides, sales tax revenues are currently ahead of the year-to-date targets that we set in December by about $158 million. We expect that trend to continue, and that's what you're seeing here in this forecast. We also significantly increased the forecast for fiscal year 22 and fiscal year 23. And of course, as you saw in the economic forecast, the sales tax result is driven by an improved outlook for personal income and home sales. Second, the forecast for individual income tax has been increased by $147 million. Fiscal year 2021, we increased it by $341 million in 22 and another $365 million above the prior forecast in fiscal year 2023. You see a big increase in a percentage if you compare 2020 fiscal year to 2021 fiscal year, but of course, a lot of that is due to the shift of about $886 million of individual and corporate tax revenue from the result of the delay in the due date. Oh, and I'm going to get to a little more detail later, so I'm going to keep moving on this particular slide. Similar situation, just mentioned with the individual income tax. That's also true for the corporate income tax. The due date was delayed there as well. If you look at the underlying corporate revenue stream, net of the delayed payments, we thought that revenue stream was about $802 million in fiscal year 2021. That's actually a little bit less than what would have been collected in fiscal year 20 had the income tax due date not been changed. That being said, the forecast did add a considerable amount of revenue to the corporate tax forecast. Again, a result that's driven by, in part, an improved outlook from IHS Markit regarding before-tax corporate profits. Moving on to the next slide, we have gaming taxes and the other taxes category. Gaming taxes as a whole are expected to partially recover in fiscal year 2021, but are not expected to return to pre-pandemic levels until fiscal year 2023. Of course, we all know fiscal year 2020 was a remarkably bad year for wagering tax collections. Riverboats and racinos were closed for the final 3 months of the fiscal year due to the pandemic. So obviously that had a very big impact on revenue. The December forecast also predicted a faster recovery for gaming revenues, but from what we've seen fiscal year to date, we are slightly lowering those expectations. Overall, total forecasted tax revenues are expected to grow by 18.3% on an as collected basis in fiscal year 21 as compared to fiscal year 2020. They are then expected to decline by 0.6% in fiscal year 22 as compared to 21, and then increase by 4.2% in fiscal year 23 as compared to fiscal year 22. However, again, the year-to-year volatility between the 3 fiscal years covered by the forecast is due in large part to the $886 million in individual and corporate income tax payments that were shifted across fiscal years. And I have a chart here in a few moments that'll illustrate that if you adjust those revenue streams for the deferred payments, you'll see the year-over-year revenue growth picture is a lot less volatile than it appears right here. Slide 12 here is intended to help you visualize the impact of shifting this revenue from one fiscal year to the next. I think you'll recall this chart from December. For fiscal year 2020, the dark blue bar represents actual revenue collected on a as-received basis, so as it actually came into the state in fiscal year 20. And the light green bar on top represents the amount of tax revenue that was shifted to fiscal year 21. For fiscal year 21, the dark blue and light green bars together represent the total amount of revenue that the state is now, with this forecast, projected to collect on an as-received basis in fiscal year 21. The dark blue bar, on the other hand, represents what the underlying revenue stream that would actually typically be attributable to fiscal year 21, or the amount that we would have received had it not been for the due date delay. Again, the point that this chart is attempting to make, and just again, this is just for everyone's understanding of the true picture, is that if the deferred income tax payments were assigned to the year in which they would have normally been received, the change in revenue between 20 and 21 and between 21 and 22 would have not been quite so dramatic. And then slide 14 illustrates this point in greater detail by comparing the annual change in revenues on an as-received basis, so the columns on the left, to what fiscal year over year collections would have looked like had the income tax due date not been delayed. And as you can see from the numbers on the right side of the chart, the annual changes in revenue are much less volatile once you've adjusted for this, this issue of deferred payments. And again, I apologize, that was a lot on deferred payments. But again, I just think it's important for everyone to understand just what the, kind of what the true picture is. Otherwise, you see these large increases, decreases, it's actually can be a little confusing, so we wanted to make sure the committee kind of understood what the underlying revenue picture would look like in a normal circumstance. And then last but not least, this is our combined statement. This shows you all the data that I just showed you in slides 10 and 11, and it's in one convenient but very difficult to read chart. We also, just for everyone who's taken a look at this out in the room or on the internet, we have added a couple of columns that illustrate the point on deferred payments. So you have columns that show revenue on an as-received basis and then revenue on an adjusted basis as well. But keep in mind the dark blue columns represent the actual and projected revenues that were or will be received by the state in each fiscal year. And then the remainder of this packet, if you care to look at it, it contains appendices with charts showing the trends in the economic variables that are incorporated into the various revenue models. Normally, we just kind of skip over this and don't say much about it. But again, you know, this is a forecast that's clearly driven by changes in the economic outlook since December, so it certainly would be worth taking a look at those slides as well. And the only other thing I want to say is for anyone who's watching online, which I think is more people than ever before, this presentation, the economic forecast presentation, and all the supporting documentation are available on the budget agency website. And that's it for the presentation. Hari and I are happy to take anyone's questions.
Questions for Mr. Jackson?
Hari or Ben, could you just confirm, were there any outside acts that passed earlier in this session that were incorporated into the forecast?
I'm going to defer to Hari on that. I don't think anything of major significance, but I'm going to defer to Hari.
Yeah, there is a couple. There's one on 1271, and which is the DLGF bill that was passed and signed by the governor, as well as the 385, which was included in there as well.
Further questions? Thank you very much. Appreciate it.
Thank you very much.
Thank you.
Thank you. Next, Ms. Taylor and Mr. Damler.
Thank you, Mr. Chairman. Members of the committee, my name is Allison Taylor. I am the Director of the Office of Medicaid Policy and Planning within the Family and Social Services Administration. I am here today, joined by Rob Damler, who will get up in just a moment, to present an updated Medicaid forecast with data through January 2021, reflecting projections through state fiscal year 2023. This forecast contains 3 main changes from the December version. And I'm going to hit those really quickly. First, the public health emergency has not ended. It remains in place, and thus we are forecasting that it will remain through the end of July 2021. It means enhanced FMAP will run through September 30, 2021. Rob will explain that impact on enrollment enhanced FMAP when he walks you through the forecast. But I just wanted to make sure committee members were clear on that component. We do have informal feedback that we could probably expect the PHE to run longer, but since that is not official feedback from the federal government, it is not reflected in this forecast. And then 2 other really critical, important, exciting, don't know the different ways to describe a couple of changes that you will see during this presentation. First relates to the 3% reduction that happens every biennium to nursing facility rates. That rule is set to expire in July, and in this forecast, we are hoping to allow that sunset to occur as a part of our global managed long-term services and supports initiative for the agency. We believe that this is a step to setting our institutional partners up for success as we roll out managed care over the next 4 years. It's an important gesture for building the infrastructure to be ready for this transformational change. So we're really excited about that. Second, the opportunity you'll see in this forecast is to extend postpartum Medicaid coverage to Hoosier moms for 12 months post-delivery. This is part of enhancing the governor's initiative for Indiana and being best in the Midwest by 2024. As you know, we have made really great progress in this space. We had our first evaluation of maternal mortality in Indiana, and it came out in the spring. The amount of good that we can, I think, collectively as a state do for moms and babies with this extended coverage is paramount. So we are really grateful for the support of our colleagues in the legislature, to the governor, to our budget partners for the opportunity to present both of these changes and hopefully add them into the forecast. If there aren't any questions, I think I'm going to hand it off to Rob, who will actually walk you through the slide deck that you should have before you, and I'll stay very close by if there's questions. Okay, thank you.
So good morning, members of the committee. Again, my name is Robert Damler. I'm a principal and consulting actuary with a local actuarial firm, Milliman. I am also a member of the American Academy of Actuaries and am qualified to make the statements and present the information to you. So as the first slide that we would like to briefly highlight, as Medicaid Director Allison Taylor had indicated, we are projecting through state fiscal year 2022 and 2023, as well as through the end of the current state fiscal year, but into the next biennium. This past December, I had presented to the members of the committee a presentation that had data and information through September 30th of 2020. We now have data and information through the end of January, so January 31st of 2021. So this gives us a little bit more insight into how the pandemic and the enrollment and eligibility has continued. As Director Taylor had indicated, we are now projecting the forecast with a public health emergency ending in July of 2021. Previously, our forecast had assumed that the public health emergency would end in January. The key consideration with the ending of the public health emergency relates to additional federal funding and maintenance of effort on the eligibility. So those are two of the primary components that impact our forecast the most. With regard to the maintenance of effort on eligibility, that needs to continue through the public health emergency, where we are not disenrolling individuals, moving individuals between eligibility categories. So you will see as we present this more higher Medicaid enrollment now that the public health emergency is going into July of 2021. The second component that I mentioned was the federal enhanced match of 6.2%. So we will receive an additional 6.2% from the federal government on all of our Medicaid programs that are not associated with the newly eligible expansion populations. So those populations receive 90% federal match. That was under the Affordable Care Act. And so those populations do not receive the additional 6.2%, but everyone else we receive an additional 6.2%. So previously that 6.2% will continue through the end of the calendar quarter of the public health emergency. So previously we were receiving the 6.2% through March 31st of 2021 because the public health emergency ended in January. Now we're assuming that we receive the 6.2% through September 30th of 2021. As you'll see in this presentation, that adds about $120 million per quarter of additional federal funding. There are some additional expenditures that offset that $120 million of additional federal funding. However, the additional $120 million does exceed the amount of additional expenditures as presented here. So on this first slide, what we are presenting are the expenditures in the upper half of the spreadsheet and the funding sources in the lower half. I have presented much of this information in the past. I'm going to highlight some of the key information. The first three line items that are listed there, and you can see that we spend approximately $8 billion a year on the three managed care programs, the Healthy Indiana Plan, which is for our parents and caretakers primarily, our Hoosier Care Connect, which are individuals, adults, and children that have disabilities, and our Hoosier HealthWise program, which includes some of our pregnant women and primarily our children population. So that program is approximately $8 to $9 billion per year in expenditures. The fee-for-service program covers our nursing home population, our elderly, those who are eligible for both Medicare and Medicaid programs, and that comes in at just over $2 billion a year. We also have long-term care institutional care, which includes our nursing facilities, and our community care, which also includes our home and community-based waiver services. So these two programs combined are about $4 billion a year. Just to highlight the next, skip down to the rebates and collections. This is primarily pharmacy rebates, so under the federal rebate program for pharmacy services, we do receive back about 50 cents on every dollar that we spend up front for pharmaceuticals. So this is the largest portion of that rebates and collections at just over $1.2 to $1.3 billion per year in pharmacy rebates through the federal rebate program and other rebates that we receive. The other expenditures is really primarily DISH and UPL payments that are illustrated there. The lower half, the majority of our funding sources are from the federal funds. You can see how those are fluctuating with fairly big increases, moving from 19 to 20, 20 to 21. Going into 2022, we see a decrease, and that's primarily because the 6.2% is only for one quarter. So in fiscal year 21, we received the additional enhanced federal match for the entire calendar year, or fiscal year, I'm sorry. But in 2022, right now, we're only projecting that we receive it for one quarter. So therefore, on a percentage basis, we are seeing a decrease in our federal funds. IGTs are intergovernmental transfers, provider tax receipts, hospital assessment fund funding, our HIP 2.0 funding sources, and we do have an offset for quality assessment fee transfer to the state budget. So you can see that we do receive $12.8 billion in 22 and $13.5 billion in our funding sources that are not reliant upon the state general fund. Again, this is just Medicaid assistance, so we did remove the CHIP program from up above, so this does not include the CHIP program. So we do see a need in fiscal year 21 that illustrated here is decreased by about $71 million from what we presented in fiscal year, in the December forecast. I'll break down the $71 million decrease. A lot of that decrease is due to the extension of the public health emergency. So since it's moving through the remainder of this state fiscal year, we are receiving additional funds. And you can see the additional funds from the federal government are listed in that very last line. So the 6.2% was about $238 million in fiscal year 20, projected to be $490 million in fiscal year 21, and $120 million in fiscal year 22. And as Director Taylor had indicated, to the extent that the public health emergency is continued through the end of this calendar year, we would receive another $120 million in that fourth quarter, approximately. So our need in fiscal year 22 is decreased by about $195 million. We'll walk through all the details on that. Again, primarily driven by two components, the additional federal funds, and we're actually seeing a decrease in the number of individuals enrolled in our nursing home population, the institutionalized nursing home population. When we were here in December, we had information through September, and the nursing home population had been decreasing at a rate, but had leveled off a little bit in August and September. The decrease kind of had slowed down. We did not project it to continue to decrease. However, the nursing home population has continued to decrease through the end of calendar year 2020 and into 2021. And so we are having lower nursing home population expenditures. We do have offsetting that. Some of that cost is we do have more people on the aged and disabled waiver, so they're being served in the community setting versus a nursing home setting. But so that has reduced our projections. The next slide that we have here is state and federal expenditures. I'm not going to spend a lot of time on this because some of these line items are not impacted by state general funds. So these are all the components in aggregate on a state and federal basis. We do have some timing differentials on our capitation payments. You can see some continuing of the maintenance of effort on the enrollment impact is fairly significant, over $400 million in fiscal year 21. Again, these are in state and federal. You can see the LTSS impact, which is primarily our nursing facility enrollment. Those, again, is a fairly significant decrease. So there are pluses and minuses here. Some of them impact our state general fund, but some of them are only impacted on its federal side because the state side is funded through either IGTs or provider taxes or other sources. So the next slide is a little bit more I will spend a little bit more time because this really focuses on our state general fund impact. So just working through, starting with the December 2020 forecast expenditures in each of our 3 years. We have continued our negotiations for calendar year 21 with our managed care health plans, and so through those continued discussions, we have adjusted our capitation rates to reflect the negotiations, and so that has had an impact on our state general fund. Higher enrollment. You can see here our higher enrollment for the first 2 fiscal years that are illustrated is a little over 40 million. Much of our enrollment growth, as you will see when we look at the enrollment projections, much of our enrollment growth is associated with the parent and childless adult populations that are covered under Healthy Indiana Plan. A lot of that funding source is either through provider taxes or from the federal government at 90%. And so it really has a much smaller impact on a state general fund basis. But we do have higher enrollment in our children populations and some of our other populations as well. So that is continuing to impact our forecast projection. There are some savings due to the public health emergency extension. There's a HIP bridge delay. The presumptive eligibility enrollment is reduced. And then the Part D clawback, which is associated with the Medicare Part D program. These are funds we pay to the federal government based on our state share. Again, because we receive an enhanced 6.2% match, the Part D clawback payment is lower. You can see here the LTSS impact is fairly significant now that we have observed further institutional enrollment decreases into December and January of this year. So we are much lower on the LTSS programs. The vaccine administration costs, previously we had not assumed 100% federal match for those, but under recent legislation, the vaccination costs and distribution costs will be paid for 100% at federal match, and so we are taking those items out that we had included previously in our December forecast. The next 2 line items are the 2 items that Director Taylor had indicated, the sunsetting of the 3% nursing facility reduction. We had previously in the December forecast assumed that that would have continued by having it sunset on June 30th of 2021. This will have an increase in our state general fund expenditure needs. And then the extension of postpartum period for pregnant women will also add additional funding needs in fiscal year 22 and fiscal year 23. The additional federal funding of 6.2%, you can see that we received an additional 1 quarter, which is the April through June quarter in fiscal year 21, and then the additional quarter of July through September in fiscal year 22 at approximately $120 million per quarter. We did have some other changes in our forecast, reconciliation changes and things of that nature due to updated data. So those are shown under other. So that just walks through each of the key line items that have impacted our state general fund budget forecast, going from the December forecast to the April forecast. The next slide focuses on the CHIP population. One of the things with the maintenance of effort on our eligibility is that many children historically have moved from Medicaid to CHIP coverage as a family's income would have increased. So as their income increases, our CHIP eligibility is higher than our Medicaid eligibility. So oftentimes children were moving from Medicaid eligibility to CHIP eligibility. Due to the maintenance of effort, those children are remaining under the Medicaid program and not in the CHIP program. And so you can see we are seeing decreases in our projected CHIP expenditures in fiscal year 20, and 21, and then rebounding back up into fiscal year 2022 as the public health emergency and maintenance of effort lapse. The other key item for consideration here, which was presented back in December, was a decrease in our federal matching percentage. So under the Affordable Care Act and then through additional extensions, there was enhanced funding for the CHIP program. That enhanced funding ends, and so beginning in state fiscal year 2022, we are at the standard CHIP match rate, which will be at about 77% from the federal government. So we do have quite a increase in fiscal need for the CHIP program in comparison to prior years, especially in comparison to 2019 when the federal match was nearly 100%. So those are the slides related to both the Medicaid and CHIP expenditures. The next two slides, I'm just going to highlight some of the enrollment projections. So each of these slides reflects the average monthly enrollment over the state fiscal year. This first slide includes all of our managed care populations, which if you would add those up, there are about 1.3 million to 1.4 million Hoosiers that are covered under the Medicaid program that are enrolled with managed care plans. We start with the Healthy Indiana plan, and I'd really like to highlight the top line item, the top two line items, which are for our HIP state plan benefit package and our HIP expansion populations. As you can see, moving from from fiscal year 2020 to fiscal year 2021, we're seeing roughly 40% increases in those populations. You can see under total Healthy Indiana plan, we have a 42% increase of lives from 426,000 average enrolled in fiscal year 20 to 605,000 in fiscal year 21. So fairly significant growth in each of these populations due to the public health emergency and maintenance of effort. Many of these individuals are staying on. Into 22, we see a slight increase, and then into 23, as the redeterminations occur during fiscal year 2022, we are projecting it getting down to more of a steady state level of enrollment, so we do see a slight decrease moving from 22 to 23. As previously mentioned, the Hoosier Care Connect population, which are individuals with disabilities, we have seen relatively flat population changes in these programs. And finally, Hoosier HealthWise, these are primarily our children. However, the rate of growth in the children population, because of the children Medicaid and CHIP programs, many of them were already covered, but with the maintenance of effort, we have seen about a 17% growth overall in our Hoosier HealthWise CHIP and children populations primarily. And then finally, I'm just going to touch base on our fee-for-service populations. We have the institutionalized, which includes more than just nursing home populations, but primarily nursing home population. You can see there that we are continuing to see a decrease, and even an 8.5% decrease moving from 2020 to fiscal year 21. Our waiver programs are our home and community-based waivers. We can see that we're projecting about 11% growth year over year, beginning in 2019 through 2023. This is primarily driven by our aged and disability waiver programs. And then we have individuals that either are partial benefit coverage or just people coming in and out of Medicaid that are temporarily in a fee-for-service program, or are dual eligibles, meaning they're eligible for both Medicare and Medicaid, and so they're not enrolled in a managed care program. So that's the residual of the individual. So overall, we are over 1.8 million Hoosiers enrolled in the Medicaid program. We are projecting into 23 that will go slightly below 1.8 million across the programs. And that is all I have at this time.
Thank you. Questions for Allison or Rob? Representative Hamilton.
Thank you, Chairman Brown. I do have one question about the postpartum funding, the new funding. I was thrilled to see that. Is that from new federal dollars? What accounts for that?
So the new federal, that program is allowable under state plan amendments today. It is a new federal program that is allowing states to add 12 months of eligibility for pregnant women as a state plan, which means it will receive the federal match without a waiver. So we are funding a portion of that, and then the federal government pays the residual. Most of these pregnant women and most of that cost will be at the standard federal match rate, which is about 65%, so they'll pay 65 cents of every dollar spent, and then the state will spend the other 35 cents of each dollar spent. But it is a new program that is allowed to be covered without a waiver.
Thank you. If I missed that earlier, I appreciate the detail. Thanks.
Representative Porter.
Thank you, Mr. Chairman. In regards to your, with the maintenance of effort, did you take into account for individuals who leave and get jobs and leave Medicaid to get jobs and to go to private insurance? Did you factor that in?
Yes. What we have been doing historically, and I can just provide estimated numbers just for ease of discussion. Historically, the Medicaid program has had slight growth each and every month, but historically we have seen approximately 32,000 people coming onto Medicaid and 32,000 people going off of Medicaid. You know, it's not exactly equal, but historically prior to the pandemic, that's about the number of people that we've seen. Today, with the maintenance of effort, it is 32,000 people coming on every single month, and really very few people leaving Medicaid. Once the maintenance of effort ends, we are going to go through a redetermination process. We've discussed that with the state. How long would that take in getting back to that steady state? So we are projecting getting back to the steady state that we had previously observed, where the number of people coming in and number of people going off Medicaid is about the same. But that's going to take, you know, a 3 to 6 month period of time potentially to get through all the redeterminations and making sure that people are not disenrolled that will end up qualifying.
Mr. Jackson.
Rob, I just want to make sure I understand. So the 1.8 million that you referenced in terms of the population here, that is just the fee for service. That's in addition to, on the prior page, the 600,000.
Yeah, the 1.8 million is in total
That is
managed care plus.
That is everybody on Medicaid.
That is correct.
Okay, all right, thanks.
Thank you. Any further questions? Thank you very much. Appreciate it. Mr. Johnston, COVID funding update. Thank you.
Good morning, Mr. Chairman, members of the committee. I'd like to take this opportunity to get us up to speed on, since our last update in December regarding the federal assistance packages related to the public health emergency, as well as maybe give set the plate for future presentations with some of the legislation that was just recently adopted. If we look back a year, there's been a total of 6 individual packages that have been adopted. And if you look at the sort of the timing, and The only reason I bring this up is because people are starting to talk about these packages this way. And so you may hear things like CARES 1, CARES 2, CARES 3. And so at least this is my best understanding of how this is characterized. But from last spring, and when you look at March through April, there were 4 packages, the largest one being the CARES Act. But that totaled, those 4 packages totaled $2.4 trillion. And then at the end of the year, December 27th, the Supplemental Appropriations Act, or CARES 2, was enacted. That was approximately $900 billion. And then most recently, the American Rescue Plan Act, or ARP, people refer to ARP, is $1.9 trillion for a total of $5.2 trillion, or roughly that amount. In our previous presentations in dealing with the CARES 1, we went through in great detail the various streams in which that money could come in. And as we talked about, it could go directly to recipients, it could go directly to businesses and providers such as hospitals. It could come to state government, state and local government, which then is passed along to participating units of government or not-for-profits in the form of supplemental appropriations to existing programs. And then finally, what we've talked about a lot is the Coronavirus Relief Fund. That was part of the CARES Act package passed on March 27th, and that was roughly $2.4 billion. The focus of that was to fight the pandemic, cover the costs that states were incurring and others were incurring, some small business assistance, and also we decided to assist local government. So you can see here we broke it down into the major categories or uses. And if you recall, on the Coronavirus Relief Fund, the State Budget Agency has entered into MOUs with the participating agencies that are connecting with their participants in this area. And so in public health, the MOUs between the State Budget Agency are primarily with Family and Social Services Administration, Department of Health, and if you remember, IEDC, the Economic Development Corporation, stood up the PPE marketplace, the Personal Protective Equipment marketplace. And so those were the primary agencies involved in the public health response. The economic and business relief component was mostly the IEDC, the workforce programs from the Commission for Higher Ed, Department of Workforce Development, and then you might recall there was a small meat processor assistance program to assist in the supply chain disruption with those operators as well. Local government, the Indiana Finance Authority, had a $300 million program that assisted local programs, and then in that category as well was the rental assistance program that the Housing and Community Development Authority had administered out of the CRF. You probably have heard about additional rent assistance that is coming. We'll touch on that in a second. I think the rent assistance program, we started with an initial allocation of $25 million. It was augmented by $15 million. And in fact, after the end of the year, the other thing I omitted to say is that, if you recall, we thought even when we met on December 16th, we thought the deadline for the spending of this was going to be December 31st. That was extended to December 31st of 2021. The rental assistance program had applications in their pipeline. We just asked them to continue to fulfill those applications, and I think the total funding actually got to $49 million in that program. And then the last category was the direct expense recovery, and those are primarily eligible payroll expenses for public health and public safety employees. So approximately 2 weeks or a week or 10 days after we had met in December, CARES 2, or the supplemental relief program, was enacted. And the The primary funding there were direct payments and augmented funding at the federal level. If you go to the very bottom of the list on the handout, the Paycheck Protection Program was a federal small business program which received additional funding. There were the direct payments, additional direct payments to individuals, augmented unemployment insurance. The areas where I'll touch on here in the next slide that were programmatic in nature that came to or through state government were in education, additional funding for contact tracing and testing, some transportation assistance, as well as the rental assistance program. So this is a slide of the money that is passing through state government from this CARES 2 package. You can see the additional funding for school corporations. Their application windows are open now. There's a lot of planning going on between the Department of Education and the education community there. The school corporation is mostly formula-based on the Title I formula. And then higher ed is also just a direct distribution to those institutions. As I mentioned, the healthcare component of vaccine support and additional financial assistance for testing. And then in the mental health and additional human services area is mental health grants, substance use disorder grants, as well as child care development grants. There is some assistance for transportation, airport improvement grants, which get funded directly to the airports, and then surface transportation of roughly $236 million. The our Department of Transportation, when the when the gas tax revenues, their revenue streams were being impacted by reduced travel last year, they were already planning on pushing projects out in future years. This is actually going to allow the NDOT to sort of get back to their original plan and projects that they were contemplating having to move out in future years. They're thinking that they're going to be able to reprogram or get them back on the original program schedule. I mentioned the Emergency Rental Assistance Program. The total amount was just under $450 million. The largest communities, I think populations over 200,000, were eligible to claim the money directly from the U.S. Treasury, and 5 counties and 1 city have chosen to do that. The counties are listed there. The one city is the city of Fort Wayne. And so the Indiana Housing and Community Development Authority is essentially working the rest of the state other than these entities. The window has opened. They've been operational, I think, since the last week of March. They've received about 15,000 applications, and they're in the middle of processing those. There's very specific rules with this program as far as priority based on income levels as well as other demographic information. So they first have to sort of pre-qualify the applications and then continue with the underwriting process. But they have started cutting some checks, and the first payments went out on April 4th. The American Rescue Plan was enacted on March 11th, and this is a stacked graph of those funding streams and program areas. These have a range of expiration dates on those grants, ranging from the shortest one, I think, is September of this year, September 21. And what we have seen so far is, I think the longest one is, except for one very small program, which really has a very extended period out to 2030, I believe, the next longest date was September of 2025. That area, again, is the biggest program areas are the economic impact payments of roughly $1,400, the state and local government assistance, which we'll touch on here in a moment, and then just a smattering of other programs, which I don't have a good comparison of how many other individual programs compared to this, but I think an organization, FFIS, that monitors this very closely, I think said there were 125 new programs related or supplemented or new programs in ARP. Here, I've simply listed, unlike the prior slide on CARES 2, where we were able to put the dollar amounts, we don't have the dollar amounts yet because those are still being worked by the federal awarding agencies and they haven't been finalized. So I just wanted to list the general areas. And so in the dark bar, you'll see the federal awarding agencies, such as Health and Human Services, but then we've tried to list where we believe the participating state agency who that would be. And so you've got Health and Human Services, which has mostly FSSA, Department of Health, and then the Housing and Community Development Authority. Again, a lot of child care, mental health, again, additional assistance on substance abuse, more testing and vaccine support, and then home and community-based services. Next slide has these program areas. Education, obviously, our Department of Education would be directly involved, Homeland Security with our corresponding agency, agriculture, which is mostly SNAP and women, infant, and children funding. Some transportation, which NDOT would be involved. The Arts Commission and State Library, some small grants coming through those organizations. And then the Treasury, which has been interesting in the last year. Mostly very interesting, I think, for them because the U.S. Treasury is not known to be a federal awarding agency for grants. And so they've had to stand up their own rules and regulations, and so it's been quite an exercise not only for U.S. Treasury but the recipients working with them. And so the state assistance programs, along with the rental and utility assistance programs, have primarily been coming out of U.S. Treasury. So let's touch base on the state and local assistance programs. I've tried to break that out. There's two major buckets. There's a state fiscal recovery fund and then local fiscal recovery funds. There's approximately $3 billion that will be awarded to the state of Indiana. The local fiscal recovery funds is approximately $2.6 billion. There is a small capital projects fund that will come to the state of $200 million. And then you can see the local distributions are broken out by counties and then larger cities and then smaller cities. What we know now, and we really just had our first call with U.S. Treasury on their the status of where we might be in getting guidance. Last year, during the CARES Act, the guidance came out. It was a very brief guidance to get started. It was came out relatively quickly. But then there was a series of updates and frequently asked questions that came out, I want to say, every 2 or 3 weeks, all the way through September. I think now the U.S. Treasury is trying to, they immediately ask for questions and input from the various associations, such as the Budget Officers Association, the Treasurers Association, Comptrollers, the Governors Associations. And so they received a deluge of questions from all of those entities. And I think what they're trying to do is put a stronger initial guidance package together. Doesn't mean that there won't be updates going forward, but I think what we heard from Treasury last week was that they were really working on the initial set of rules to get everybody going for a while. And so they may take, I think it's about 60 days they have to actually start getting the process going. And so they may take all the way into the first week of May to get their guidance out. But as we've got here, some of the process items here is states will have to certify to U.S. Treasury in order to request the funds. The payment is supposed to come out from Treasury within 60 days of that certification. The Secretary of the Treasury has the discretion to withhold up to 50% of your allocation for up to 12 months, and then the state would be required to submit another certification at the 12-month period. Funds are available through December 31st of 2024, so a little bit different runway than we had last time. So we're talking about 3.5 years overlapping the next couple of biennia. The State Fiscal Recovery Fund, the eligible uses and prohibited uses. And this is where all the questions came from. These 4 bullets really, what does government services to the extent of reduced revenue? So how do you calculate that? What's the starting point? What's the comparison point? So I think there's going to be a lot of questions that. The second bullet, I think, really is the best way to put that is a continuation of the CARES Act, or the Coronavirus Relief Fund. You're able to use the money to respond directly to the public health emergency and its negative economic impacts. There's a component there for premium pay for essential workers. And then finally, this is the most specific in it, is the bullet point is necessary investments in water, sewer, and broadband infrastructure. There is a provision that allows for transfers of your money. We'll have to see what that guidance is. We had used that in the Coronavirus Relief Fund, where we directed $300 million to local governments. It was a similar transfer provision. And then prohibited uses is using the direct deposit into your pension fund to shore up pension funds. And then this last one has already started some back and forth with the U.S. Treasury of what this means is when they say offsetting a reduction in net tax revenue resulted from changes in tax laws, regulations, interpretations, and administrative matters. The latest guidance, I think, or what has come out is actually changing your tax law is going to be a key factor there, is if you change the tax law and use this money directly to cover whatever that tax reduction might be. Now, the clarification that came out, there were a lot of tax provisions in these bills, such as the Paycheck Protection Program allows certain deductions for businesses. What they're saying is if you conform with the Internal Revenue Code or the outside acts of the federal government, if you take those actions to conform with what was adopted in the federal legislation, then you wouldn't be penalized for that. But again, I think this is one where we'll be getting further clarification there. And then I'm stating the obvious on the last bullet there. Both the eligible and prohibited uses are going to be influenced by the forthcoming guidance. I mentioned the $200 million Capital Projects Fund. This is pretty much lifted from the federal legislation. It is for critical capital projects, enabling work, education, health monitoring, including remote options in response to the public health emergency. And that process is still being developed. And finally, the Local Fiscal Recovery Fund. This money will go directly to counties, larger cities, and other cities and towns. They have similar uses and restrictions as state governments do. As far as the distributions go, counties and the larger cities, so I think they're using the cities that have a population of 50,000 and greater are going to get direct distributions from the U.S. Treasury. All other municipalities, the money will come to the state of Indiana, and then the state is required to turn that money back around within 30 days out to those eligible entities. There's going to be a little math involved because they say you have to do the comparison. they cannot receive more than 75% of their budget in January of 2020, I think. And so that's going to take some work to do to make sure we're in compliance and not over-distributing to the individual cities and towns. So a lot of work yet ahead, but I'll stop there, Mr. Chairman, and entertain any questions.
Thank you very much. Senator Melton.
Thank you, Mr. Chair. Thank you for your report. Just a few questions that I have in terms, I want to go back to the rental assistance program. The rental assistance program,
Yep.
you had listed the counties. Is there a way to kind of identify what agencies were used in those particular counties? Just so we're aware of what was used. Was it township, the trustees, or were there other agencies?
I don't have those. I will ask Jake Sipe, whose team they have weekly calls with the 5 counties and the city of Fort Wayne, and I'll find out who the primary contacts are or the administrators of that and get that to you.
Great, thank you. The next question, in terms of going back to the transportation projects, I believe from the previous CARES Act, the funds that have come to the state of Indiana, and the upcoming, the proposed $2.1 trillion that's going to come, will NDOT have those plans and bring it before the budget committee? Do we know how that's going to go, or are they already planning some of those previous projects to go into implementation?
Oh, I don't know whether they're scheduled to do that. I think what they are planning to do is go back to their prior plan that they put in place that they now can fund. They were going to push projects out in future years, and so I think they're going back to a plan that had already been published.
Right. I think the last question I have in terms of local communities, right? Maybe this is broken down in a couple questions. How are larger cities classified? Is that based off what, population or geographic boundaries?
Yeah, I really don't like the phrase, but I think they follow the guidelines of the Community Development Block Grant, and they call them entitlement cities and non-entitlement cities. And it's based on population, which I think is 50,000 and greater. And so there's probably a couple dozen cities that will get the money directly. And then all the others will just, that's the funding channel will come to the state, and then the state will turn around and send the money out to the smaller communities.
Right.
But the dividing line is generally 50,000 or higher or lower.
Some of the questions I received from constituents were once they identified or learned of the dollars that were going to be coming both to or allocated to communities and to schools, were a lot of questions around transparency and how those dollars will be reported back to the public. I don't know, will the state have a role in that in terms of providing that level of transparency back to the public on how local municipalities, counties, et cetera, plan to use and have used all federal dollars, not just ARP, but those that were used in CARES in the past?
On the $300 million that went out, the Indiana Finance Authority had not only the original allocation, but then the actual distributions. Now, most everyone claimed their full distribution, but they've had it out on their website that people can see, the dollar amount that was drawn. Mm-hmm. They've been answering a lot of questions about how the money was used. And so I think the IFA's done a good job of that transparency. Under the current, I'd have to check, but I don't think that there's any mandatory reporting for locals, but there might be on how they use their money.
Okay. When I'm looking at I believe the third or fourth last slide, when we talk about eligible uses, in the second bullet point says, respond to public health emergency or its negative impacts, including assistance to households, small businesses, and nonprofits. That's kind of where I started thinking is, will the locals, if they're going to do these type of programs, do they have to get it approved from either U.S. Treasury or the state, or is it just, this is what we're going to do, this is how much we need, and they get that certification?
Well, there'll be an allocation that's set aside for the locals, and except for the counties and the larger cities that will get their money directly, there is that one sort of arithmetic test that we have to look at the allocation, and I'll just make this really simple. Say an allocation for Indiana town is $100. If their budget is $75, we are not required, we are not allowed to send $100. We can only send $75.
Gotcha.
So that will go out there, but I would presume, just like any other spending of money, it's going to have to be presented to their council, whether it's county council, city council, or town council.
Great, thank you.
Senator Couture.
Thank you, Mr. Chair. Thank you, Director Johnson, for your presentation. A couple of quick questions. Are any of the federal dollars through the 3 stimulus packages that we received or we will receive contingent upon the continuation of the emergency declaration? Meaning, if that goes away, do we risk forfeiting any federal dollars?
In the money that's coming in this fiscal recovery plan and the CRF, I don't think that there is, but there are some, I think FEMA and maybe FSSA have some isolated programs that are contingent on the continuation of the public health emergency, but not in the dollars that I've been talking about here.
Got it. Thank you. My second question, the 15% cut to many state agencies based on the previous forecast, does OMB have recommendation or would be supportive of restoring the 15% reduction to agencies in light of today's forecast?
I will defer to my colleague, Mr. Jackson here, but I think we've been, I think it started maybe in December that the process of reevaluating the 15% across all the agencies was started back with the forecast in December, and I think it's continuing. But I don't know whether, not Mr., I know you're a committee member. I shouldn't be putting you on the spot, should I?
Sure, go ahead.
Thanks. Yeah, we have, and just to be clear, are we talking about the 15% holdback that we did on the current fiscal year, or as part of budget development?
Part of the budget development for the new biennium budget.
Yeah, so in the governor's final version of the budget, we restored, I'll say several, but not all agencies back to the 15%, and then we've been working with budget writers to work on that a little bit more for some agencies. I know not every agency will be back to where they were in the current budget. There are some that, you know, this has been a good exercise of just how much do they actually need. But most agencies will be back to or pretty close to where they started.
Thank you. This is helpful because I think in my mind I look at a couple of line items. It's especially in the Medicaid forecast where we noticed that there was a reduction in long-term or institutionalized residence and nursing facilities, and some folks stayed at home. Yet in the FSSA budget we saw a $5 million reduction on the choice program, for example, as an example. So I think there are some critical places in the budget, including in FSSA's mental health, even aside from the one-time federal dollars, but the disability or independent living choice program or other programs. My final question, and directed to Director Johnson, on the, is there a place on the website, the OMB's website, or somewhere maybe I can get information from you guys on a crosswalk between the dollars that we received under the previous 2 stimulus packages, how much exactly was spent, and what is the current balance? Is that public information that can be shared?
It's on the state budget agency website.
Do you mind if you shared that link with me?
Yeah.
Thank you, appreciate it.
Further questions? Thank you very much. Members of the committee, you have before you an agenda. Are there any additions or corrections to the agenda? Seeing none, the agenda is laid on the table. We have before us January 2021 minutes of meetings. Are there any additions or corrections to January 2021 minutes? Can I have a motion to approve those?
Second.
It's been moved, seconded, approve January 2021 minutes. All those in favor say aye. Aye.
Aye.
Opposed say nay. Motion carries. We have March 2021 minutes. This was an item that was sent around for members of the committee to sign as far as Medicaid policy planning amendment review. Any discussions or motion on March 2021 minutes? Can I have a motion?
So moved.
It's been moved and seconded to accept March 2021 minutes. All those in favor say aye. Aye. Opposed say nay. And motion is adoption. March 2021 minutes are adopted. We'll get into the agenda then of agency projects today, and we have first the Indiana State Museums. Ms. Faree, thank you very much for being here.
Thank you, Chairman Brown, members of the committee. We have reached our $1 million match, and we have looked at how we can best spread that across all 12 of our locations where necessary. These are projects that fall above a preventative maintenance project, but not quite at the magnitude of a CR&R project. There are also projects that we feel will help move us forward in order to be more sustainable and earned revenue. So I will walk through these with you and be happy to obviously answer any questions. Angel Mounds, which has been able to continue to hold its attendance this past year. It is predominantly an outdoor project, but we do believe that it has the potential for being one of our largest sites and would like to do what's called a cultural landscape report there so that we could better understand how we can continue to maximize that site. The Corydon State Capitol, as part of the 2016 Bicentennial Project, had a gazebo built that was important to the community and as a part of that community square in Corydon. Unfortunately, the product that they used failed, and we'd like to replace that and put it back into the Indiana Landmarks quote so that it can continue to be utilized not only for the community but also by us for programs and events. In Rome City, on Gene Stratton Porter's property, there's a large, beautiful barn that has the siding is coming apart, which means the elements are coming in. We believe if we can restore that barn, we can not only use it for storage, but more importantly, we can use it for events, for weddings and programs, and feel like it can help generate revenue for that site. We have two projects at the Lanier Mansion. The Lanier Mansion is the crown jewel of the Madison, Indiana Main Street Historic Street, and we would like to look at, there is a fence that goes all the way from the river all the way up to the street, so all the way around the parameters of the site, and we'd like to look at, over the years it has been, quote, fixed, unquote, and it needs to better understand what parts and pieces are actually a part of the gating community and which part of it needs to actually be restored. In addition, we are continuing to try to offer programs outdoors as people are most comfortable there. And as one of the attractors, we would like to enhance the gardens at the Lanier Mansion. At our Levi and Catherine Coffin site, there is a barn that holds the wagon that people used to hide in as they headed north on the Underground Railroad. Unfortunately, that roof is leaking, and we need to have that wagon as part of the important component of the story of the Underground Railroad and need to fix the barn roof there. At New Harmony, there was a room on the second floor of the community house number 2. For some reason, it was not completed. We are now looking at doing partnerships across the state of Indiana about New Harmony, and would like to finish out that room so that we could use it as a gathering place, as a place to do webcasts and podcasts and things that would allow us to expand that story statewide and farther. There are two projects at Vincennes State Historic Site. One of them is at Fort Knox. There is a log barrier at Fort Knox that really tells the story of why it's significant. We have found that a system that was used prior that sealed the logs that were there caused them to become sponges and rot from within. And so we would like to go back now and replace those such that the story there can be told and the impact can be made by replacing that log replacement across the barrier such that we can complete that experience. Secondly, there are 4 significant houses that represent the main component of the Vincennes State Historic Site. Several of those, I know this is my favorite thing to talk about window restoration, but we do have to glaze them, which means they have to be hand glazed and replaced, and we need to bring those up to restoration levels, including replacing some of the siding on that building in order to make sure that it feels like the preservation is being taken care of at the level that we all would agree was necessary. The White River State Canal is a challenge, and there are 2 locks there. There's lock 24 and 25, as well as a nationally recognized aqueduct. Those locks have not been in workable form for several years. In addition, we had a deer get caught in one of them and had to release the deer, which caused more, and you can't make this stuff up, which caused more damage to the locks. So we really need to look at what that canal needs and understand at what point we could or could not restore those locks and continue to have the aqueduct working at the level at which we need it, as well as to preserve it at the level that it needs as a federally recognized historic site. And then there are 3 projects we would like to do at the State Museum here in Indianapolis. The building here will be 20 years old next year, and we would like to clean it. The vista of that building down the canal that looks then onto the State House is one of the most photographed and telegraphed vistas probably in the state of Indiana. If you watch football at the beginning of a Colts game, that is the vista that is shown, as well as it's photographed quite frequently. We'd like to clean the building for its preservation and safety, as well as for its ability to continue to represent the state in the way we would all like. In terms of earned revenue, there are 2 projects there we'd like to enhance. We have an education center and a lunchroom. Our camps have and continue to be one of our largest and most effective programs. Due to COVID, but in addition to room supply, we would like to upgrade those rooms so we can expand the number of camps we have, not only today with the COVID numbers, but also in the future as more and more people are comfortable bringing their kids back to camp. We are able to serve a significant portion of the downtown community because people can drop their kids off while they're here at work, and we feel like that's a program that we can continue to grow if we can bring those rooms up to the status they need to be in order to be effective. And then lastly, we have a celebration crossing. The market in Indianapolis for the holidays is quite competitive. We believe if we can match these dollars with some private dollars that we have done, that we can start to really compete for the holiday audience here in town by offering a train ride that would really enhance what you can do when you're at the State Museum to compete with the other large cultural institutions in the city. Museums are predominantly visited. Their largest visitation is the week between starting the day after Thanksgiving, working through New Year's, and we would like to be able to be a place that people instantly think to come so that we can start to pick up our attendance at a time that we believe people will start to go back to museums. And with that, Chairman, that's our request for today.
Thank you very much. Appreciate it. Any questions? Thank you very much.
Thank you for your time.
Presentation. Next, we go to Ivy Tech. Mary Jane.
Good morning. Thank you, Chairman, members of the committee. Ivy Tech is here to request approval to spend some funds on our Muncie Fisher building, which is on High Street in downtown Muncie. In November, our building experienced an explosion due to a switchgear failure. I had to look it up. I didn't know what a switchgear was, but it's switches, fuses, and circuit breakers used to control and protect and isolate electronic equipment. That was directly linked to the reliability of the electrical systems in the building. There was then a secondary explosion, and it set off our sprinkler system, and as a result, there was significant damage to the lower level of the Fisher building. This was one of the buildings that we had received funds in the 2017 biennium to restore, and so we are asking for funds to restore this to the pre-explosion status. It's the lower level of the building, which includes 4 classrooms, 3 science labs with supporting space, a faculty collaboration area, and our bookstore. No one was hurt in the explosion. It happened in the middle of the night, so the building was unoccupied, fortunately. Our state board has approved up to $5 million to allow us to begin the bid process. We don't anticipate that it will cost that much. We believe somewhere in the mid-range of $3 million. We will be using reserves from tuition revenue to do this while seeking insurance proceeds. 3 classrooms and 1 lab had minimal damage, but all of the rest was significant damage. We do have access to floors 1 through 4 of the building, but again, science labs on the lower level are critical to the hands-on component of the education for our students. And so we're respectfully asking for approval to move forward with that. And with that, I'll answer any questions.
Senator Brown.
Thank you very much. Thank you. I was just curious, the last line notes that you are pursuing insurance proceeds.
Yes.
So this may be a question for someone else. Does that money then go back to the state general fund if we're spending money now for them to fix this?
This is actually Ivy Tech's own money from their operating fund, so it'd go back to Ivy Tech. Further questions? Thank you very much.
Thank you. Have a good afternoon.
Ball State University, Ms. Poltz.
Good morning, Mr. Chairman, members of the committee. Thank you for the opportunity to ask for approval of our Grand Lawn Amphitheater project. We're very excited about this project. It's a $3.15 million project from gift funds, which is an exciting thing for us to have gift funds for this project. We certainly are concentrating our efforts on increasing gift funds, and to digress for just a minute, we're celebrating this month our efforts to secure new donors. We had a successful One Ball State Day of Giving. It was our 3rd annual Day of Giving, but individual gifts were over 9,000 individual gifts, up from 2 years ago of just over 3,000. So we hope to have more projects funded in this way in the future. Back to the project, it's about 4,600 square feet of amphitheater space. As we know, over the last year, we've really thought about space on our campuses and how to make them as flexible as possible. We're certainly planning for a more normal fall, but this will give us a little bit of flexibility as well, although we certainly anticipated this project before these interesting times. The amphitheater would be usable for our theater and dance programs. It would be also for student activities, weeks of welcome, and those sorts of activities. Also community activities and partnerships. That's obviously a focus for Ball State. We certainly see it as a possibility when we bring folks like from Muncie Community Schools onto our campus, and so we're certainly excited for those sorts of things. So with that, I'm happy to take questions about the amphitheater or uses for it or other items.
Thank you. Any questions? Will the amphitheater have any name associated with it because of the gift?
At the present time, we're calling it the Grand Lawn Amphitheater, but we're very excited. There was $100,000 generously given from the John Anderson Foundation, but the remainder, the over $3 million of the project was given from alumni Charlie Brown, who also donated the funds for our planetarium. So I'm not sure yet.
Okay, thank you. Any further questions? Thank you.
Thank you.
Next, Purdue University, Ms. Hazlett.
Good morning. Thank you, Mr. Chairman and members of the committee, for the opportunity to be with you today. We are here to seek your approval for the repair of a section of roof on the Armstrong Hall of Engineering. Armstrong Hall is located on our West Lafayette campus, and it is truly a cornerstone in our College of Engineering. It opened in 2007, so the existing roof is approximately 14 years old, and in 2019, we had a day of very high winds, and there were multiple roof panels that broke loose from their connections when the rivets securing those panels failed. We do have some temporary measures in place to ensure that the roof is safe in the short term, but a long-term solution is necessary. In addition to this safety issue, our facilities team, as they looked at what needed to be repaired, also found problems in the substrate, including an unlevel surface that contributed to the failure in 2019. The flashing at the gutter line was installed improperly, and that allowed water to run under the flashing. And finally, we have found leaks in other areas of the roof, which means that the membrane is compromised. So with your approval of this request, we will repair each of these areas, address some of the safety concerns, and prevent future damage by increasing the security of these metal panels. This work, we believe, will extend the life of the roof by 20 to 25 years. The size of this area to be repaired is 24,000 gross square feet. This project will cost $3.5 million and will be paid for with funds that have already been provided with our FY 2021 R&R appropriation. We are looking to begin construction in August. We would hope to be done by April of next year. So with that overview, I'd be happy to answer any questions that you might have.
Thank you. Any questions? Thank you very much.
Thank you.
Indiana University, Dr. Morrison.
Morning, Mr. Chairman, members of the committee. My pleasure to be with you again on behalf of Indiana University. Proposing to you today for the renovation of the Collins Residence Hall complex on our Bloomington campus. This is a project that we had ready to be before you about a year ago. It was all ready to go. We had bid it, and right at the beginning of the pandemic, and then you asked the question, rightfully saying, "Are you sure you want to do this?" And our trustees and us, we came back and said, "You're right, we don't at the moment," because none of us were sure what the pandemic would entail. We didn't know whether we were going to need this for quarantine housing or not. And so we put the project on the shelf for the year, got through this academic year, but now feeling much better about moving forward with the renovation project as part of our long-term housing renovation plan. Good news as well is this project was estimated, is estimated to be a $23 million project, renovating 3 historic buildings. This is the oldest residence hall at Indiana University, and thus probably one of the oldest residence halls in the state of Indiana. But the good news is that we just bid this project pending your approval, and prices came in still below budget a year later. And so that would tell you about the competitiveness of the construction markets right now, and we're looking to take advantage of that. This project will be funded by housing and dining fees on the Bloomington campus. Like I said, it is part of a long-term renovation plan for our entire stock of housing. We've been at this now for about a dozen years. I'll probably have one more to bring to you, and then we will be done with this program. It'll be funded, as I said, by housing and dining fees. We will be bonding it. And again, rates at the moment, just checked this morning, we're just below 2%. And so we're looking forward to that as well. Be happy to answer any questions you might have.
Thank you. Any questions? Thank you very much.
Chairman.
Thank you. Next, we go to Commission of Higher Education, Mr. Hattenberg.
Chairman Brown and the members of the State Budget Committee, thank you for giving me the opportunity to speak today about the Indiana Primary Care Scholarship. My name is Kyle Hattenberg, and I serve as Director of Enrollment Management at Marian University College of Osteopathic Medicine. In our first 4 classes as of May 2020, we have graduated almost 600 new osteopathic medical students. Of those, 174 have participated in the Primary Care Scholarship Program. Specifically, for our graduates in the first 4 classes, primary care specialty areas of family medicine, internal medicine, OBGYN, pediatrics, and general psychiatry rank in the top 7 specialty areas our students are completing residencies in. So far this year, as of March 15th, we awarded 116 scholarships that totaled $1.32 million. We expect that number to rise to 121 awarded scholarships by the end of this academic year, as stated in our request letter under the 2021 academic year projection header. Overall, the decision to incentivize students to work in primary care and serve the state of Indiana after graduation has been overwhelmingly positive. One of our core missions at the College of Medicine is to produce primary care physicians for the state of Indiana. Annually, more than half of our incoming students are residents of the state of Indiana. If you look at osteopathic physicians nationally, nearly 57% practice in primary care, and for Marian, over 62% of our students go into residencies in primary care medicine. So, we are trending towards producing primary care physicians higher than the national rate. With that, I am happy to take any questions.
Thank you very much. Senator Brown.
Thanks very much, Mr. Hattenberg, and I appreciate you responded at least to some of my potential questions in this materials, but I just want to make sure, so the first class graduated 4 years ago, so if they matched immediately, they'd probably be out of their family practice residency?
Yes, so
Or whatever,
normally it
if
takes
it's 3
about
years.
3 years,
Mhm.
yes. So we are right now going through the process of getting all that information. Obviously, this was a little bit of a different year to try to get all of that information together. So we will have that information to the committee, and we'll get that to the Higher Education Committee so that can get to you here in the next month to 2 months as we tabulate all that.
Okay, because I have expressed concerns. I think the last time we had this conversation, it's really up to the Higher Ed Commission, is my understanding, to track these students who have received the scholarships, who have an obligation after they complete their residencies to come back to Indiana for 5 years. Is that correct?
So it depends on how many years they take the scholarship. So
Okay.
it's a year to year. So if they take the 4 years of the scholarship, then they would come back for at least 4 years. Hopefully, they'll stay longer.
Right.
But they would have a minimal commitment of 4 years.
But we should at least know if some are potentially finished their residency, then we should know, at least for that group,
That is correct.
that have been out for a year, if they're actually back in the state of Indiana.
That is correct, and we'll make sure that we get that information.
Okay, and I just have a couple of other questions. I guess I'm a little bit concerned on number 6. She said, how many graduating students, for whatever reason, are not in compliance now? And there are 6 students that are not in compliance due to withdrawal or dismissal. So my understanding is the scholarship money lost is just lost, then, is that correct?
That is not correct. So we do work with the Higher Education Commission. So if those students do not follow through on that commitment, then that would go into repayment. The Higher Education Commission partners with Heartland ECSI to manage the administrative process of the loan servicing. So if they owe a year of loans, then that would be managed through the Higher Education Commission by Heartland.
Okay. And then finally, then on number 5, it says of graduating medical students, how many pursued a residency in Indiana, which does not fulfill their requirement, correct? Does it?
It does fulfill their requirement. So if they, the way that it is written is if they're a resident in the state of Indiana, that would count towards what their service time of the scholarship.
Okay, well then I guess I would like to know how many are paying it back in a sense that way, because they're going to match somewhere. And
Right.
it does help if they have their residency in Indiana, but my concern is if they then don't stay here after the residency,
Yep.
then in a sense, they've matched here on purpose to pay off the loan, and we really haven't benefited, because we know we will fill those slots regardless, and we know we have a higher likelihood. So if you could get me the information of how many are fulfilling, as this has gone on, fulfilled their loan repayment obligations by doing a residency, and you have not stayed here, I'd like that information.
We can absolutely get that number. I will note just off my information, over 50% do match into primary care residencies in the state of Indiana. The hope, though, is, right, if they took the 4-year loan, they would have still 1 year remaining to pay back, and then that gets them more committed. The other piece that I would say there is it is more likely if, students that match and are in residency in that state do tend to stay in that state at a higher percentage. So that is our hope, that we get students to be residents, do their residency in the state of Indiana, and then that would hopefully encourage them to stay for practice.
Right, okay, thank you.
Absolutely.
Mr. Jackson, did you have a question?
Thank you, Mr. Chairman. What is the average cost for the osteopathic program in terms of per student?
Yeah, so cost of attendance, which
Yes.
covers a whole lot of pieces, about $74,000 per year.
Okay, thanks.
Representative Porter?
Thank you, Mr. Chairman. I have a couple of questions. You say you graduated over 600 thus far, and I think you said 116 scholarships. Also in your presentation, what is the demographics of those individuals? How many minorities, how many women?
So there is roughly 6% is underrepresented in medicine, and then roughly a little over 51% are female.
51% are what?
Are female.
Okay, roughly. What does roughly mean?
I mean, 51%.
51% is a female.
Are female.
So minorities, African Americans, how many are in that?
I don't have it broken down specifically, but
I would like to have that information.
we can get that information. Absolutely.
Also, my other question, Mr. Chairman, if I may, I know when we first start funding Marion in regards to this, they were going to serve in underserved areas. Are they still doing that? It was part of legislation, and it was deleted, that they did not have to, a percentage of those students did not have to serve in underserved areas. Are they serving in underserved areas? If they are, where are they?
So I can get that that information to you. That is the mission of Marion University, is to serve in the underserved area specifically of the state of Indiana. And so I know that from residencies, there's less residency spots in underserved populations, so it's going to be certainly once they go into practice, that information is going to be more readily available. But we can get that when we get the information for that first year class that's now a number of them are practicing in the state.
And what is the timeline for you to get us that information, please?
We can get that probably here within the next 2 months at the.
Within the next 2 months?
Yes, absolutely. Probably within.
2 months?
Yes. How soon would you like that, Representative Porter?
A lot quicker than 2 months.
Okay, we can have that with you. We'll work with the Higher Education Commission and try to get that within the next, how about 3 weeks?
3 weeks?
Yep. Does that sound better?
2.5. Thank you.
Okay.
Thank you. Any further questions? Thank you very much.
Thank you all very much for your time.
That concludes our agenda for today and the items on the agenda. Any discussion by members of the committee? May I have a motion to approve the agenda?
So moved.
It's been moved and seconded to approve the agenda of the Budget Committee on April 15th. All those in favor say aye. Aye. Opposed, say nay. It is carried. The agenda is moved. Having no other items today, we are adjourned. Thank you very much.